just interested in it, but, are actually working in this field. So it's great to know that you all have some form of connection. And yeah, let's get into it. So just some of our past work. The breast and chest feeding work group was born out of the work from the first state physical activity and nutrition grant in Illinois, so the SPAN grant. So since this was a newer area to the coalition in IPHI, we needed to start by convening a broader group of partners, listening to families, and engaging in strategic planning. So this strategy work group helped us develop a strategic framework for the SPAN project overall, which then became our guiding document for the Enhancing and Expanding Breastfeeding Grant that we received from IDPH. So this work group helped us connect to families across Illinois for the early focus groups and guidance that the focus group materials ended up helping us with develop. And then they have also supported multiple requests for applications process to get funding out to communities across the state, including many folks serving as reviewers. The group has also provided guidance on best practices, resources, trainings, and connection to training or keynote speakers. And finally, the group serves as a connection to communities across the state, both providing input based on local experience, as you all have stated, and sharing resources and opportunities with local partners. So we're excited to have you all and be able to hopefully use each other's connections and experiences to kind of further this work. So some of our recent grant work, this slide depicts some of it from the ISPAN grant that I mentioned and the EEB, or Enhancing and Expanding Breastfeeding Grant, that we received from IDPH. So the ISPAN grant that we just completed from 2018 to 2023, that geography spanned statewide, as well as Chicago, Cook County, Peoria, Tri-County, Jackson County. The framework was overall to improve continuity of care, increase knowledge of chest and breastfeeding, and increase connections and referrals. So our focus in that work was to create new referral systems and provider connections, chest and breastfeeding business recognitions, developing lactation provider workforces, and increasing trainings for ECE providers, as we all know, that helps with lactating parents' decisions to actually continue lactating as their children go into school. So Enhancing and Expanding Breastfeeding, that grant we received from IDPH, that was from 2021 to 2023. The geography for that was also statewide and included Peoria County, Southern Illinois, and Cook County. And the objectives were to focus on workforce development, continuity of care, chest and breastfeeding equity, as well as chest and breastfeeding communication and access. So our focus in our work there was to create more chest and breastfeeding trainings for home visitors and those closest to the lactating parent, diversifying the lactation workforce and growing it, creating continuity of care between hospitals and community organizations, and overall trying to help expand some of the ISPAN work that we were able to implement at the time as well. So our SPAN and EEB both work to support communities across the state to improve the partnerships and policies, processes, and procedures to better support families in their chest and breastfeeding goals. Even though the focus of each grant kind of varied slightly, they both supported implementation of our framework that we initially developed with SPAN. So right now, our new grant work, we were grateful enough to get a second round of both grants. So we are now in the second round of Illinois State Physical Activity and Nutrition Program from 2023 to 2028. That geography is statewide, as well as 2 other regions that we have not determined yet. Additionally, that framework will also be to continue to improve continuity of care in chest and breastfeeding, increasing knowledge of chest and breastfeeding, and increasing connections and referrals. Our second round of Enhancing and Expanding Breastfeeding, as well with geography, continues to be statewide, as well as some specific regions that we are choosing. and that will be from 2023 to 2025. And those objectives continue to be continuity of care, chest and breastfeeding equity, and workforce capacity. The difference in our focus with this year's EEB grant is that we're going to focus on prenatal provider engagement, so OBs, any other lactation providers or community centers that focus on the prenatal parent, as well as consistent messaging and sustainable PSE changes. So some of the things that you all were able to mention. So new grants, these recently launched, but we will also have some activities from these grants that will launch soon. So as we get into it, we'll be looking to this group to help, keeping our focus on prenatal providers, support for home visitors and doulas who will soon be able to bill Medicaid for their services, and just overall more investment in regional and community level continuity of care. So I'll go over our framework and then I'll pull it up on the screen after I'm done so that we can kind of see it in a different level. So the first goal in our framework for breast and chest feeding is to improve continuity of care and support for chest and breastfeeding in communities, including improving the knowledge, connection, referrals between hospitals, primary care providers, WIC, early childhood education centers, work sites, academic centers, home visiting, social and community programs, and services to support low-income, rural, African-American, and/or Latin-E parents to meet their chest and breastfeeding goals. Some of the strategies, I won't read all of them just to make sure we have time for discussion, include supporting implementation and enforcement of organizational workplace policy. We've seen that that's been a big barrier to help promote and normalize chest and breastfeeding. We hope to help expand obstetric and pediatric visits to include chest and breastfeeding education. We hope to help create a statewide resource directory slash referral network to increase continuity of care and referrals to lactation support services and/or integrate into existing regional referral networks. And we hope to just continue to create and grow relationships between the clinical and community centers that are in that are throughout Illinois. So our pediatric offices, FQHCs, and community-based lactation services and private professionals. So the second part of our framework is the goal of improving lactation support knowledge and education of all providers, which includes pediatricians, OBGYNs, family medicine, nurses, etc. Those objectives will include improving education and awareness of chest and breastfeeding support opportunities in the prenatal period across all prenatal health care and support providers, so that more pregnant parents include chest and breastfeeding in their birth and postpartum plan, or at least have the option to. Objective 2 is to increase access to lactation education and support immediately after labor and delivery and in the first week after birth, because we know how important it is to get that first latch on, if possible, or at least the first ingestion of breast milk or chest milk. So some strategies that would help us achieve that goal include increasing and requiring education in all health professional training programs on chest and breastfeeding, including culturally relevant information, increasing diversity of the lactation support workforce by offering trainings for family support professionals and those that are closest to the lactating parent or have similar experience to the priority populations, as well as increasing access to culturally responsive lactation professionals prenatally in the hospital, birthing center, and the early weeks postpartum. So with that in mind, let's have a little bit of a discussion with the last 10 minutes here about, what are you excited to talk about if, you end up wanting to join this group? What are your interests in it? What sticks out to you from our framework? Or, what do you see more work being needed to be done in your area? So whoever, you can always take yourself off mute. There's only a few of us here. And I'll pull up the framework so that you can see that while we're talking. All right, there you go. So based off of our framework and what I've just discussed, what is everyone interested in, helping to develop some of these strategies? Which strategies would you say you're most interested in right now, based off of what we see here?
I would say having been a mom who breastfed 3 kids and worked, and then also my history is in political science, and I focused a lot on like medical leave and breastfeeding policies on a federal level and state level. That's probably what I'm most interested in personally. Also, just that prenatal appointments, including more breastfeeding topics, I think is very important, and I like to see that that's an initiative.
Thank you. Anyone else? Allie, Audrey?
Yeah, I second what Jessica was saying. I think the workplace policies is really important. I think even if organizations or places of business have even good workplace policies on paper, the implementation of those is also not always great. I mean, I've been in workspaces where it's like, yeah, there's a lactation room, but like, what does it look like? How clean is it? What are the facilities in there? So one, I think tackling the policy and having people adopt a policy is great, but then also kind of guidance and best practice, or I don't know, looking at implementation. I was really interested to see that you've got lots of training in so many different places, which is great, especially the federally qualified health centers. But that made me think, because I also come from a mental health background, and I think of just infant and early childhood mental health, and also just that involves the mental health of the caregiver, and how breastfeeding and lactation can be closely tied with mental health, either supporting mental health, supporting attachment, but also it could create challenges with mental health if it's not going well, or hormones are changing. And so I'm just curious how much training would be interest, or how much interest there would be in training places like the community-based mental health centers, or any other place that, say, clinicians might be.
So that's definitely of interest. I just think these were just kind of some of the organizations that we placed on here. But for sure, I know in our last group as well, we did speak about how that mental health aspect of the parent is so important, especially with postpartum anxiety and postpartum depression, being a big part of why someone would not be able to choose it, or probably feel as though they cannot continue with it. So that is something that we are looking into and would be a part of the whole creating relationships between hospitals, health centers, and community-based lactation services and professionals. That's just, I think right now, with the partners we have some partners that already do webinars with mental health specialists. And so we very much promote those, as well as try to get more, I guess, focus group type information from our partners, and hopefully from this group, about what you all think we could do to help those type of situations. So just you bringing it up is a good reason why we're all here. So thank you for bringing that up, Allie. Um,
Yeah,
and go ahead. Sorry. Go ahead, Audrey.
it's okay. There's a few of them that stand out. One is, workplace policies that promote and normalize chest and breastfeeding, because a lot of times when you're in hospital, and that's where creating the relationship with hospital comes in, is that they don't always, in certain groups of people, just don't even assume that they're interested in chest and breastfeeding. So the policy should be to offer that service, or have something there for everybody, not just choosing who you believe will breastfeed or who won't. And so I think that's where the policy will come in, and having relationships will come in, and that would be including in increasing and requiring education with health professionals on chest and breastfeeding. So I think all three of those things will be important in trying to kind of forward this chest breastfeeding lifestyle.
Thank you, Audrey. And Yvonne, I know you stepped away. We're just talking about what of these strategies here on the screen would you be most interested in? Or if you just, have anything you would like to bring up that maybe not be on the screen or anything like that, you can feel free to. But these are the strategies we're hoping to help implement to reach our goals that are on the left. And everyone else has already had a chance. So if you want to, Yvonne, but if you still need time, please let me know.
So the strategies that are in bold?
The strategies are on the right and the
Oh,
goals are
okay.
on the left. So
Okay.
what strategies would you be most excited to kind of get into or talk about based off of, your interest in this work group?
One that I really haven't had a chance to look through all of them, but the
No
one that
problem.
really stood out to me was ensure consistent chest feeding, breastfeeding messaging across lactation education providers, including hospitals. I think hospitals is extremely important because a lot of the hospitals throughout the city of Chicago isn't baby friendly. So I think that education component might be lacking in that area. Yeah, community centers and schools and childcare centers as well. One thing that it might be an option to add, I was really trying to implement more baby friendly childcare centers where moms can come in and easily breastfeed their babies. So that's one topic of interest that I was definitely trying to implement.
No, that's perfect. Thank you for that. Because I know we only have probably like a little over a minute left, but these are all very helpful. So what this work group will really be doing is really trying to see how we can use each other's experiences, subject matter experts from different organizations, connections to help promote more equity, further the strategies that we have listed to help us get to the goal. So it's not necessarily program development, more as you all providing advice and overall helping us strategize how to best do this work and focus on the framework that we have here and keeping it all in mind while we're going through it. And even coming up with, newer ways of thinking about like let's look at these community health behavioral centers like Ali mentioned. That's something we didn't have listed, but now I need to make sure that we have that listed because that's a big part of the chest and breastfeeding decision. So yeah, thank you all very much and